So, with distal limb extremities, we talked in the Robert Jones bandage module about if we had a distal limb extremity such as a radial ulnar or a tib fib fracture, and this was going to be repaired surgically, we would put on a Robert Jones. And then post-surgically, upon recovery, when this animal was recovering, we would put on a modified Robert Jones. Okay, well, what if this particular fracture is not going to be surgically repaired, but instead, maybe due to financial reasons, surgery is not an option, or maybe personal preference with the veterinarian, maybe they feel that this fracture would be better healed with using a splint. So a Metamason splint is going to be used for distal limb fractures that are not going to be repaired surgically. Okay. Everything with the Metamason splint is the same as a Robert Jones or modified Robert Jones, with the exception of where you place your stirrups. You placed your stirrups for the Robert Jones and the modified Robert Jones, medial and lateral. For the Metamason splint, we instead are going to put the stirrups cranial and caudal. And snug that tape down to your patient. And caudal. So, if we were helping this fracture along with the aid of a splint, just like the Robert Jones, we need to work all the way from the elbow here all the way down to the carpus. I have just brought in one type of splint. This is just a very basic type of splint, and it comes in many different sizes that we would size it to support this animal's limb. So obviously this particular splint is way too thin. We would want to have it at the width of the leg here. And we might need to cut it because can you see here that this splint would be jabbing into the back of her leg. So again, we can get the old hacksaw out and cut it. There are actually amazing splints that are made specifically for a given limb. Just like in human medicine, they'd make a little template of your own extremity, and they would make it so it was especially for you, and we have that capability as well. So, but I'm just going to use this for efficiency purposes. Okay, sleeping dog, hold that there. Now we need to have some padding. And again, we're going to pad all the way from the joint proximal and distal of the fracture. And think about your padding being similar to that of the amount of padding you had with your modified Robert Jones. Now we need to snug all of this down, and so let's use our cling gauze, starting distally. If we started proximally, it's going to be on too tight. You're going to snug it too tight. And again, I'm going to give you a little bit of a workout. As you make your way up more proximal, make sure that you are consistent. But at the end of the day, you're going to look at your bandage to ensure that there's a consistent amount of padding from the carpus all the way to the elbow. Seems to be my trend today that right in the area of the elbow, it's just too poofy, too paunchy, too chubby. Tuck it. Hold that there, sleeping dog. Hold that, hold. Anti-Tracy toilet paper. Well, it's not the prettiest, but it's ultimately, I should have put a little bit more cotton padding down here. Do you see how it's a little skinnier than up here? And I was worried about that when I did it. I should have just done it. Now, to keep that splint in place, just like the Robert Jones, the modified Robert Jones, my tongue depressor really was useless there, wasn't it? Tracy made it useless. Twist it, don't pull. And just snug it on the cranial surface. And remove your tongue depressor. Rotate it. And without tugging on it, pull it straight up. Have it so it sticks to your bandage material. And complete this bandage by covering it all with your superficial layer of either your vet wrap or your elasticon. And then put your funky little designs on it. This is just a little, is it too tight?
My hands are always cold and I have skin irritation, so.
Okay, so this is normal.
Yeah, it's
Okay.
from degreaser at work.
Can you feel me?
Yeah, I can.
Good. But that's, you need to always have a toe exposed, at least one toe exposed. In this case, we can have all of our toes exposed, but even if you were doing some sort of bandage over a phalange, you need to be able to observe it for being too tight.